Left of the box. From Sherry on Twitter says breaking, where's the enforcement in the Canada Healthcare Act? This should be illegal. And she's quote tweeting this saying hundreds of Toronto patients were left scrambling after a family doctor closed her practice and moved to a private health clinic that charges $5,000 annually. This isn't just about one doctor and thousands of patients abandoned. It's about the erosion of our healthcare system. This shouldn't be happening. Okay, this should not be happening where we're losing our doctors to these private cares where it's like, okay, $5,000 a year doesn't sound like much to some people, but for people who live with poverty, that's a lot of money. And we shouldn't, like, in our healthcare system, this simply should not be a thing. The federal government is supposed to be cracking down on this sort of thing. Instead, the federal government is just allowing the provinces to get away with privatizing our healthcare.
Yeah, it's ridiculous. Well, especially when you consider the history of provinces and the feds and the different levels of federalism that have existed since the beginning of our country till now. And you realize that the way Trudeau does federalism with the provinces is not the only way to do federalism. And so he's making a choice to say, whatever the provinces have jurisdiction over, I'm going to wipe my hands of. And if I don't have to step in it, I'm not going to, even if it's to the detriment of people. And I find that gross.
Panic and confusion after a family doctor in Toronto closed her practice for good and moved to a private health clinic. Months later, some of her 1,600 patients are raising their voices at Queen's Park, calling this an example of the downfall of the public healthcare system.
This isn't just about one doctor and thousands of patients abandoned. It's about the erosion of our healthcare system, in particular, primary care delivered by family doctors.
87-year-old Wendy Campbell is one of the patients who were left scrambling last March. Her family doctor shut down her practice with just 3 months' notice. The private clinic the doctor moved to comes with a hefty fee.
This shouldn't be happening. There shouldn't be clinics in Ontario that charge $4,995 a year in order to access medically necessary care.
Like I say, like there's so many people without a family doctor right now, and this is important when we get to the disability benefit when we start talking about that. But then there's also people who have family doctors that live very far away from them or they don't like, they're not compatible with. But you're forced to stay with whatever you have because your other choice is to simply go without a doctor.
Yeah, yeah. And so like even within our province, we had the biggest thing the election was ran on last time was on healthcare. That we had a waiting list of people without a family doctor, and at the time it was around 80,000 people without a family doctor in a province of 1 million. So you're looking at almost 1 in 10 people not having a family doctor, and that has skyrocketed to about 160,000 people without a family doctor. So now you're looking at, well, about 1 in 8 people. 1 in 8 people don't have access to a family doctor. And the government's solution is to instead of fixing the wait list and reducing the numbers, they're going to get rid of the wait list. So, hey, if there's no wait list, then that means there's no problem, right?
Yeah.
So they're just going to get rid of it and just let people experience what they experience.